Anxiety. It is the social situation phobia which affects 1 in 10 and can be diagnosed at any point in their lives. Over a 4-part documentary, we'll be looking at this issue and 3 other disregarded mental health issues affecting the youth of today. Welcome to the Mental Echo. Social anxiety disorder is the excessive fear of embarrassment in social situations that has effects on personal and professional relationships. Phobias are persistent, irrational fears of certain objects or situations. They recognise that their fear may be excessive or unreasonable, but are unable to overcome it. Regular social anxiety is known to all of us as an uncomfortable feeling of nervousness. Many people have particular worries about social situations, like public speaking or talking to authority figures, or experience more general feelings of shyness or a lack of confidence. 4 million people in this country also suffer from phobias, a type of anxiety, which are an irrational fear of anything from needles to air travel to spiders. You do not have to be a nervous person in general to suffer from any of these problems. However, social phobia can be extremely disabling to a person's work, social and family relationships. People with these disorders tend to lead difficult and diminished lives. The emotional toll of the disease is great. Many people with social phobia have trouble reaching their education and professional goals, or even maintaining employment. They may depend on others financially and try to relieve anxiety with alcohol and drugs. In extreme cases, a person may begin to avoid all social situations and become housebound. Both men and women can suffer from anxiety, and it can be triggered by anything from redundancy to moving house to relationship problems. Individuals who suffer from anxiety are also likely to suffer from panic attacks. Panic attacks can be extremely frightening experiences. Sufferers commonly feel breathless, have chest pain and a rapid heartbeat. But during a panic attack, you are not in physical danger. All these symptoms are caused by the release of hormones in your body, such as adrenaline. Panic disorders strike between 3 and 6 million Americans and is twice as common in women as in men. It can appear at any age, in children or in the elderly, but most often it begins as young adults. Not everyone who experiences panic attacks will develop panic disorder. For example, many people have one attack but never have another. For those who do have panic disorder, though, it's important to seek treatment. Untreated, this disorder can become very disabling. In the NHS social anxiety leaflet, researchers suggested that anxiety may be caused by an imbalance of certain chemicals that occur naturally in the brain. These chemicals are known as neurotransmitters. If the level of these chemicals in your brain becomes unbalanced, it can significantly affect your mood and increase your likelihood of developing anxiety-related conditions such as GAD. However, GAD is most likely to have a complex combination of causes, rather than being triggered by just an imbalance of brain chemicals. Some include your environment, experiences, and genetics. The first step to helping yourself or a loved one about anxiety is to recognise the issue and develop some knowledge on it. There are many informational websites on anxiety, including the NHS. We'll include links in the description below. However, talking to your GP or school nurse about your concerns will give you a direct path to follow through to recovery. If you're concerned about your own safety involving anxiety and other conditions, approaching a medical professional is something you should consider, if not just talking to a friend, so they can support your first steps to recovery. Treatments for anxiety can include medications, a specific form of psychotherapy called cognitive behavioural therapy, tranquilizers, antidepressants, and sometimes beta blockers. Cognitive behavioural therapy teaches a patient to react differently to the situations and bodily sensations that trigger anxiety symptoms. There is no one way of coping with phobias, but different strategies work for different people. Some people might prefer to work on their own self-help program. For example, someone who was afraid of air travel might start a fear of flying course, while others prefer to get involved in self-help groups, or to work with a psychiatrist or therapist, or do a combination. If any of the topics covered in this episode affect you, or if you want more information on anxiety, we'll include a list of websites, books and leaflets you can refer to in the description. Your GP and school nurse can also answer your questions. Feel free to contact us with any queries or requests, which we can address in the following episodes at thementalecho@gmail.com. If you are suffering or know someone who is, remember, knowledge is the first step to understanding.